Department of Health reporting more than 1,800 new cases since Thursday. Our total now almost 987,000 as we take a look at it. ODH also reporting 209 more deaths linked to COVID-19. Right now, almost 950 Ohioans in the hospital with the virus. More than 11% of the state's population has completed vaccine treatment. This comes as President Biden is calling for all adults to be eligible for vaccines by May 1st. Many are celebrating. Others, like cancer patients and retail workers, they got growing concerns. NBC4's Alan Henry joining us now live to share what those workers are worried about. Alan?
Well, Brad, when thousands come out here to be vaccinated next week, only those who are eligible will be seen. But some worry by the time cancer patients are eligible, they'll have to stand in line with everyone else.
Alan, I really don't have an answer as to why they haven't been included.
Dave Dillahunt is the executive director of the Ohio Hematology Oncology Society. Both he and the American Cancer Society have been reaching out to the state, asking them to put 10,000 cancer patients under the age of 50 on the eligibility list.
We're a little baffled too. At least 17 other states have included cancer patients in phase 1C.
The research so far has told us that cancer patients and anyone really with a history of cancer is at a higher risk of severe disease linked to COVID-19.
It's not just cancer groups making the push. Ohio's Food and Commercial Worker Union also reached out to Governor DeWine this week, asking for their 80,000 members to be included as well.
They're frontline workers. They've been on the front line for a very long period of time. They're essential workers, and we feel with them being essential workers, they need to be prioritized and move forward.
Shoppers I spoke to agree.
Oh, absolutely. I mean, they are exposed to majority of the people in the community, so yeah.
That's crazy to me that, cancer patients they should be number one, in my opinion.
And with just 7 weeks until President Biden's goal to open up eligibility to all, there remain concerns about vaccine supply and demand.
The concern is that cancer patients of any age can get caught up in, a bottleneck of other adults, healthy adults, who are trying to get their vaccination appointments as well. And so that's why we think it's, time sensitive, and it's really important that the state begin prioritizing cancer patients right away.
A spokesperson with the governor's office tells me those supply issues are exactly why all Ohioans aren't eligible to be vaccinated yet. But the governor has said those groups make compelling cases for inclusion and could be included in future phases. Local for you in Columbus, Alan Henry, NBC4.